Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good morning, everyone. Let's begin with a familiar scene. Someone wakes up with pressure behind the eyes, a tight band around the forehead, or a pulsing pain on one side of the head. The first thought is usually, what painkiller should I take? But pause there. Ask a better question. Why is the head hurting in the first place? And then ask the next one. How could a simple nutrient like vitamin C influence something as complex as head pain? Do not think of vitamin C as a magic tablet. Think of it as a biochemical tool. It does not replace diagnosis. It does not replace migraine medication when migraine medication is needed. It does not replace emergency care when warning signs are present. But when used wisely, vitamin C can support several pathways that are directly connected to headaches: inflammation, oxidative stress, histamine activity, blood vessel integrity, immune activation, and nutritional deficiency. So, listen carefully. If a headache is sudden and explosive, if it is the worst headache of someone's life, if it comes with weakness, confusion, vision loss, fever, stiff neck, fainting, head injury, pregnancy complications, or a new headache after age 50, do not experiment. Seek urgent medical care. That command comes first. Safety before supplements. Now let's develop the idea properly. Start with this. Vitamin C, also called ascorbic acid, is not just the orange vitamin. It is a water-soluble antioxidant, an enzyme cofactor, and a supporter of connective tissue. The National Institutes of Health notes that adult men generally need 90 milligrams per day, adult women 75 milligrams per day, and people who smoke need an additional 35 milligrams per day because smoking increases oxidative stress and lowers vitamin C levels. Food sources include peppers, citrus, kiwi, broccoli, strawberries, Brussels sprouts, tomato juice, and similar fresh plant foods. Also remember this practical point. Vitamin C is sensitive to heat and water, so raw, steamed, or lightly cooked foods preserve more of it than long boiling. Why does that matter for headache? Because the brain is metabolically demanding. It uses oxygen intensely. When the nervous system is under stress, poor sleep, infection, emotional strain, skipped meals, dehydration, allergy exposure, intense exercise, or hormonal shifts, oxidative stress can rise. In migraine research especially, oxidative stress and mitochondrial energy strain are repeatedly discussed as part of the biological landscape. Reviews in migraine literature describe how mitochondrial dysfunction and reactive oxygen or nitrogen species may contribute to migraine susceptibility, while antioxidant systems are part of the body's counterbalance. So ask yourself, how does vitamin C help here? It donates electrons. That sounds technical, but make it simple. Vitamin C helps neutralize unstable molecules before they irritate tissues, amplify inflammation, or disturb vascular signaling. In practical language, it helps lower the chemical noise around sensitive nerves and blood vessels. Headache, especially migraine, often behaves like an over-alert alarm system. Vitamin C may help reduce one layer of that alarm, especially when intake is low, stress is high, or the diet is poor. But do not stop at antioxidants. Go deeper. Ask, why do some headaches arrive with allergies, sinus pressure, flushing, food reactions, or weather changes? One answer may involve histamine. Histamine is a signaling molecule released by immune cells. It can widen blood vessels, increase tissue swelling, irritate nerves, and contribute to pressure-like or throbbing sensations. People often recognize histamine through sneezing, itching, watery eyes, congestion, or reactions after certain foods. But histamine can also interact with head pain pathways. Here is where vitamin C becomes especially interesting. A study in the Journal of Nutrition examined human blood samples and found that lower plasma ascorbic acid was associated with higher blood histamine. in a small group of volunteers, taking 1 gram of ascorbic acid daily for 3 days reduced blood histamine in every participant. Do not overstate that study. It was small in the supplementation part, and it does not prove that vitamin C cures headaches. But do not ignore it either. It gives us a plausible bridge. Vitamin C may help some people whose headaches are linked with histamine-heavy states such as allergies, congestion, food sensitivity patterns, or inflammatory immune activation. Now ask, how should someone use that information? Use it like a clinician would use a clue. If a person's headaches cluster during pollen season, after histamine-rich foods, during colds, after alcohol, with facial pressure, or with flushing and congestion, look at vitamin C intake. Do not jump straight to massive doses. First, correct the foundation. Add vitamin C-rich foods daily. Try kiwi with breakfast. Add red pepper to lunch. Use broccoli or Brussels sprouts at dinner. Put strawberries into yogurt. Choose whole foods first because they bring potassium, fiber, polyphenols, and hydration along with vitamin C. Then ask, what if food intake is inconsistent? A modest supplement may be reasonable for many adults, commonly 250 to 500 milligrams with food, especially during periods of high stress, low produce intake, respiratory infection, or allergy exposure. Keep it measured. More is not automatically better. The NIH lists the adult tolerable upper intake level at 2,000 milligrams per day, and high intakes can cause diarrhea, nausea, abdominal cramps, and may increase urinary oxalate in susceptible people, which matters for those with kidney stone risk or kidney disease. People with iron overload disorders such as hemochromatosis and those receiving chemotherapy or radiation should discuss supplementation with a clinician. Now let's connect vitamin C deficiency to headache-like states. True scurvy is not common in developed countries, but low intake still happens, especially in people with very limited diets, alcohol misuse, food insecurity, eating disorders, severe gastrointestinal disease, dialysis, smoking, or chronic illness. Vitamin C deficiency impairs collagen synthesis, weakens connective tissues, contributes to gum inflammation, bruising, fatigue, joint pain, poor wound healing, and anemia-related symptoms. The NIH describes early deficiency signs such as fatigue, malaise, and gum inflammation, and as deficiency progresses, capillary fragility and connective tissue weakness appear. Why mention this in a talk about head pain? Because not all headaches begin inside the skull. Some begin in the whole body. Fatigue, anemia, inflammation, poor sleep, muscle soreness, gum disease, neck tension, immune stress, and vascular fragility can all make the nervous system more reactive. If the body is undernourished, the head often becomes one of the loudest places where the message is heard. So command the basics, check the diet, check the gums, check bruising, check energy, check iron status if fatigue is prominent, check smoking exposure, check whether the person has gone weeks eating mostly processed foods with little fresh produce. Now let's bring in population-level evidence. A 2024 cross-sectional analysis using NHANES data from 1999 to 2004 reported that higher dietary vitamin C intake was associated with lower odds of severe headache or migraine among adults. In the fully adjusted model, the highest vitamin C intake quartile had 22% lower odds compared with the lowest quartile. Be precise, this does not prove causation. It may reflect healthier overall diets, better metabolic status, or other lifestyle factors. But it supports a sensible clinical message. People who consistently consume more vitamin C-rich foods may have a lower headache burden, and improving diet quality is a low-risk step for many. So, how do we turn this into a practical plan? First, identify the headache type. Is it tension type, migraine-like, sinus-associated, dehydration-related, medication overuse, caffeine withdrawal, menstrual, sleep-related, or something that needs urgent evaluation? Do not treat every headache as the same event. Name the pattern. Second, correct the foundation. Hydrate. Eat regular meals. Sleep at consistent times. Reduce alcohol if it triggers pain. Avoid skipping breakfast if fasting triggers headache. Move the neck and shoulders. Limit excessive screen strain. And add vitamin C-rich foods every day. Third, use a headache diary. Write down sleep, stress, foods, weather, menstrual timing, caffeine, allergies, medications, and vitamin C intake. Why? Because memory is a poor laboratory. A diary turns vague suffering into visible patterns. Fourth, consider a measured vitamin C trial if appropriate. Choose food first. Add a modest supplement only if needed. Take it with meals to reduce stomach upset. Do not exceed safe limits. Stop or reduce the dose if diarrhea, nausea, abdominal cramping, or worsening symptoms occur. If there is kidney disease, kidney stones, iron overload, G6PD deficiency, active cancer treatment, pregnancy with complications, or complex medication use, ask a healthcare professional first. Fifth, combine vitamin C intelligently. Do not use it alone while ignoring magnesium, riboflavin, hydration, sleep, blood pressure, vision correction, dental disease, sinus disease, or medication overuse. Headache care works best when multiple small causes are addressed together. Now, why can vitamin C be beneficial and effective for some people with headaches? Because it can support the body at several pressure points at once. It helps restore deficiency. It supports collagen and capillary integrity. It contributes to antioxidant defense. It may reduce histamine burden in some contexts. It supports immune function during infections that can trigger head pressure. It improves non-heme iron absorption, which may matter when fatigue and anemia are part of the picture. And it encourages a diet pattern, more fruits and vegetables, that often improves hydration, potassium intake, gut health, and overall inflammatory balance. But keep the message disciplined. Vitamin C is not a universal headache cure. It is a supportive intervention with stronger logic in specific situations. Low fruit and vegetable intake, smoking exposure, high stress, allergies, frequent colds, histamine-like symptoms, poor wound healing, gum bleeding, easy bruising, fatigue, or diets that have become narrow and processed. Use it where the biology fits. Do not force it where it does not. Let's close with a simple image. A headache is like a smoke alarm. Sometimes the smoke is migraine chemistry. Sometimes it is muscle tension. Sometimes it is dehydration. Sometimes it is histamine. Sometimes it is a warning signal from something serious. Vitamin C does not remove every cause of smoke, but in the right person, it can reduce sparks, oxidative stress, histamine activity, tissue fragility, and nutritional depletion. So give the body what it needs before it has to shout. Put color on the plate. Protect sleep. Track patterns. Respect warning signs. Use vitamin C with knowledge, not hype. And when headache becomes frequent, severe, or changing, involve a clinician and look deeper. Take care of yourselves and take care of one another. We are learning together like a family around the same table. See you in the next topic.